Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Very glad that you could join us today. Our guest in studio today is Dr. Akram Alashari. He's a trauma surgeon, critical care physician, and the author of the book, The Power of Peak State: Massively Enhance Your Personal Potential. He's among the youngest in the United States to ever be board certified in general surgery, attaining that certification at the age of 28 after first earning a medical degree at the age of 23. And he's here today to talk with us about his experiences in trauma surgery and also how the peak state has helped him to overcome some of the traumas that he's associated with on a daily basis. Welcome to Health Professional Radio today, Dr. Alashari.
Thanks, Neal.
Thank you. You attained board certification in surgery at a very young age. That's quite a mature undertaking for someone who's, 23, even in your mid to upper 20s. How did you achieve such a feat?
Neal, by no means was it easy. Mm-hmm. But what it takes is a committed focus. I feel that once we know what we want, then it doesn't matter anymore how hard it is. As long as we've decided that that's what we want and we're committed, we can attain it.
So basically, whatever you put your mind to, you can achieve, yeah?
Absolutely.
General surgery differs greatly from trauma surgery. And when we're talking about trauma surgery, is that any type of trauma or a specific type of trauma? Say, not necessarily a car accident, but trauma due to a previous surgery. What type of trauma are we talking about?
So for the most part, it's any type of traumatic injury. So what I see for the most is falls, even from ground level falls, mm-hmm. trips and falls from ladders, falls from people falling from trees, and any types of falls, car accidents, stabbings and shootings and assaults, mm-hmm. and even sports injuries as well. So any type of injury you can think of, even burns as well.
I ask about these types of trauma that you deal with because the person who's fallen down the stairs is going to have a different frame of mind than the person who's been electrically shocked or maybe the person who's survived an auto accident and is about to go under. How do you deal with these people from, a surgeon to patient point of view, and how did the peak state help you achieve this, balance between helping them and maintaining your cool?
So the most important thing is knowing the fact that once they arrive in the trauma room, I have to assess if there are any life-threatening injuries. Mm-hmm. And so it's very chaotic because there are multiple physicians involved, nurses, technicians, and we're all trying to help the patient. But it's up to the trauma surgeon to orchestrate all of that and at the same time determine whether or not the patient needs life-saving surgery. So in order for me to help the patient, I've got to maintain my cool, I've got to be able to communicate well to everybody involved, and I've got to make sure that I'm orchestrating the care of the patient and dealing with life-threatening injuries. And being in a peak state of mind gives me the clarity of focus and clarity of thinking that allows me to do that much more effectively.
In dealing with trauma victims, how has the peak state allowed you to deal with the stress? You're coordinating a massive effort with everyone trying to help one particular patient or maybe two, but it's a concerted effort on a focal goal. And you are at the helm of all of this. What about the stress factor? Once you're at this state of peak performance, are we talking about the stress just magically disappears, or is there some mechanism that allows you to compartmentalize certain stressors to make them ineffective when it comes to your peak performance?
A great question, Neal. What I basically do is modulate the level of stress. Mm-hmm. I recognize the fact that too much stress is going to lead to distress, and it's going to lead to being ineffective, whether I'm in the trauma room or in the OR. What I need to obtain is a level of eustress. Eustress is where you're at your peak performance, where you match the level of complexity of the case with the level of your skill. And so by elevating my level of consciousness and my level of awareness, my level of confidence increases, and that allows me to better take care of the patient. What happens with the stress is it doesn't go away, but rather I utilize the increase, the rush, the adrenaline rush to enhance my powers.
So this is all done within you through this state of mind, yet you're having physical manifestations of energy, adrenaline, clarity, and, as you say, equaling out the stress with your particular level of skill. That being said, does the peak state tell the truth when it comes to your limitations, or are your limitations expanded due to the peak state?
When you're in peak state, you have increased abilities and ability to do things you've never done before because you're out of your comfort zone. But when you're out of your comfort zone, when you're in peak state, you're okay with that. So rather than the rush of hormones and adrenaline being detrimental and causing you to say shake in the OR, which adrenaline can do, rather it increases your clarity of thinking. So you redirect these hormones and these feelings to enhance your abilities.
When did you first discover this peak state? When did a light go on in your head and say, hey, this is something that I can tap into at my discretion?
I remember distinctly a day when I was a fourth-year surgery resident, and I was the chief of the service, and a trauma had come in, and the patient had sustained multiple gunshot wounds to his neck, chest, and abdomen. And the attending physician who oversees the residents wasn't readily available. And I remember taking care of this patient all the way from the trauma room to the OR and being able to do things in a way that I never had done before. And I realized it was because of this heightened level of awareness and that things were just moving so smoothly and in such a good way that I said, why don't I reproduce this feeling when I want to and enhance my abilities? And that's when it was.
Now, you do have a website associated with your book, yeah?
That's correct. powerofpeakstate.com.
Now, if we go there and we visit this site, what type of information will we find there about attaining this state for ourselves, apart from buying the book?
So I've provided content, both video content as well as audio content, on perspectives and ideas and thoughts on how you can change the way you think and how you can elevate your level of thinking and your level of consciousness so that you can start to become better at being out of your comfort zone and start to realize that there's so much more to tap into, so much more that you're able to do. And you can also communicate with me directly through the website as well.
All right, that's some really, really great information, and that is thepowerofpeakstate.com?
Yes.
Yes, thepowerofpeakstate.com. And I'm assuming that your book is available at all the major literary outlets, Amazon, booksellers, and whatnot?
Oh, yeah, it's available online through Amazon as well as through CreateSpace.
Great, thanks. You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio this afternoon speaking with Dr. Akram Alashari, trauma surgeon, critical care physician, and author of the book, The Power of Peak State, Massively Enhance Your Personal Potential. And he's been in studio today with us talking about being a trauma surgeon, the different types of trauma that he has to deal with, and how the peak state has helped him maintain his cool while coordinating effective care of his patients. It's been great having you here with us today, Dr. Alashari.
Thanks so much, Neal. I appreciate it.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.